Hi, myself Soumya Rahul, and I'm an online DHA Heart Prometric and NCLEX trainer. And today I'm here with an important topic of nursing subject, that is myocardial infarction. It is a very well-known topic for everyone, and it is as important as it is. So we know that myocardial infarction is commonly called as heart attack. That is a well-known term for everyone. So before going for the actual topic, now let's see what is myocardium. We know that myocardium is a middle layer of the heart. Heart has three layers. Heart is our most vital organ in our body, which has three layers in it. There is a outermost layer is called as epicardium, middle layer is called as myocardium, and the innermost layer is called as endocardium. So middle layer myocardium is the actual muscular part of the heart which helps in the contraction and relaxation of the heart, and it is called as contractile part of the heart. So whenever there is a blood supply is decreased to the myocardium, the myocardial tissue is not receiving adequate amount of oxygen and nutrients, the cells are more prone for cell death and permanent cell damage or cell death can occur. We know that whenever we are not receiving any oxygen, when you are deprived of oxygen for few minutes, we can't survive for more than 5 minutes or 10 minutes, because oxygen is as important as it is. So like that, the cells, whenever the cells are not receiving adequate amount of oxygen and nutrients, they are prone for cell damage. So that condition is called as infarction. The cell death is called as infarction. So whenever the myocardial tissue is deprived of oxygen and nutrients, it can leads to cell death. That condition is called as myocardial infarction. So the term myocardial infarction means the cell death or damage occurs because of decreased blood supply to the myocardium. So why there is a decreased blood supply? What is the cause? What is the etiology behind that? So it is because any block to the blood vessel which supplying to the myocardium or the layers of the heart or to the heart walls are called as coronary arteries. Coronary arteries. So whenever there is a block in the coronary arteries, the myocardium is deprived of oxygen and nutrients. We know that the oxygen and oxygen and nutrients are delivered by the blood vessels. So whenever the blood vessels are blocked, there is a decreased blood supply to the particular part of the area. That is called, it can lead to infarction or cell death. So whenever the coronaries are blocked, it can lead to the cell death or cell damage. That is called as myocardial infarction. So why the coronaries are getting blocked? So coronaries can be blocked by several reasons, but the most common cause of it is atherosclerosis. So what is atherosclerosis? Atherosclerosis is nothing but whenever your high blood blood cholesterol level or lipids levels are on the higher side, it can deposit in the arteries, causing narrowing of the arteries. So whenever there is a narrowing, it can lead to the decreased blood supply. So narrowing of the arteries is caused by, first cause is atherosclerosis, that is a fat plaques which accumulates in the arteries, or it can be due to any clot or thrombosis. The clots are called as thrombosis. Thrombosis can occlude the coronary arteries. Even that can also lead to the decreased blood supply to the myocardium. So whatever may be the reason, the block in the coronary arteries is the main cause of myocardial infarction. So how will you identify that is a myocardial infarction? Myocardial infarction has some typical signs. The main sign of myocardial infarction is chest pain. Chest pain. So the pain has some characteristic. All chest pains are not indicative of myocardial infarction. Myocardial infarction pain has some characteristics. So it will be one crushing or squeezing type of pain you feel, and it will be on the left side of the chest, will be radiating to the neck, back, shoulders and left arm. See, radiating pain is a main characteristic of cardiac pains. So whenever the pain is getting radiate to the left shoulder, arms, jaw, back and neck, it can be myocardial infarction. The patient may be experiencing an infarction and heart attack. So the pain will be like that, and it has some other associative manifestations like palpitation they can feel, and dizziness, syncope can occur. Some patients may feel lightheadedness, dyspneic, anxious. So patient will be more anxious in this kind of pains. So whenever you get a patient in the emergency, the first thing you should do, so whenever you are learning the things for competitive exams, the first thing you should do learn is what is a priority, what is a priority action, what do you do. So if you get a patient with a myocardial infarction, first thing you have to do is administer oxygen to the patient. So you can administer oxygen to the patient. First you should get what is a pain description, like first you should confirm whether it is an cardiac pain or not. With a single characteristic you can identify that is a cardiac pain, that is a radiation. The pain will be radiating to the left arm, left shoulder, left side of the neck, back, it will be radiating. So what you will do next, so first priority goes to the, you should administer oxygen to the patient. Oxygen with a nasal cannula, we know nasal prongs, we can give maximum 4 liters with a nasal cannula. Then what you will do, so next priority comes, you will be administering nitrates, that is a nitroglycerin or NTG. It can be administered under the tongue, that is a sublingual is usually given. So as it is a vasodilator, especially act on the coronary arteries and dilates the arteries. So it dilates the artery so that the spasm or there is a dilatation. So whenever you are administering nitroglycerin, so it can cause vasodilatation and decrease in the patient blood pressure. So that has to be taken care. Next thing what you do is, you will be administering morphine to the patient. Morphine. So morphine, we know that is an opioid analgesic. Morphine is an opioid analgesic. It's a narcotic. So it is administered for pain mainly, and the second thing is it decreases the oxygen demand on the heart muscles. So it gives a relaxation to the heart, so we'll be administering morphine. So you should take care that whenever you are using some narcotics, there are some side effects for the narcotics, like respiratory suppression. Respiratory suppression can occur. So for that what you will do, you should be ready with an antidote. Antidote for all the opioid analgesic is naloxone or Narcan. That is an important point, that is a naloxone and Narcan. So then you will be giving morphine. Now we have given oxygen, nitrates and morphine. So and you can give anticoagulants or antiplatelets like aspirin. Aspirin will be given for the patient, and you should stay with the patient. You should take a 12 lead ECG for a patient. Then you should stabilize it, and the position follow for myocardial infarction is, and the most of the respiratory and cardiac condition, the preferable position is semi-Fowler's position. Semi-Fowler's position will be given for the patient. So you should never leave the patient alone, because patient is very anxious. We don't know what will happen to the patient next. So it can lead to heart failure, arrhythmias. There are a lot of complications. That's the most common complication associated with myocardial infarction is cardiac dysarrhythmias. Cardiac dysarrhythmias can be developed for the patient. And heart failure, you should take care of the blood pressure of the patient. And if the patient is within the first 6 hours of incident of myocardial infarction, you should go for a thrombolytic therapy with the urokinase or streptokinase. They are called as thrombolytics. And whenever you are giving a thrombolytic, next you have to take care of for the bleeding. So after administration of thrombolytics, the nursing responsibility is you should take care of bleeding, that is whether the patient is getting any bleeding or not. Then you can give a complete bed rest to the patient, and the beta blockers will be given in the later stage. And nitroglycerin is actually given in the first 24 hours only, and later you are not using any NTG or nitroglycerin for the nitrates for the patient. So and you should go for a lifetime modification of the diet for the patient. And the important part of it was the diagnosis. We missed it, and the diagnosis of myocardial infarction is mainly the most sensitive indicator of cardiac damage is troponin levels. Troponins are the proteins released from the cardiac cells. So whenever there is a cardiac damage occurs, these proteins will be released into the bloodstream, like troponin I, C and T. So this elevation is the accurate indicator of myocardial infarction. Second thing we go for is an ECG. So there are ECG changes depends upon the which part of coronary artery is blocked, but it will be the myocardial infarction is main characteristics. First is ST elevation, that is ST segment will be elevated, and the T wave will be inverted. There is an inversion of T wave and a abnormal Q wave. So once we have done the treatment with all these things, that is our ST segment and the T waves will be returned to normal. But our Q wave changes will be permanent for the lifetime. Whenever we take an ECG, it will be there that it is an indication that the patient had an MI in the past. So these are main indicators. Then after the stabilization of the patient, you can go for a cardiac catheterization or angiogram. So angiogram will be identify where is the block, and it exactly tells you where is the block. But the question point is, the most sensitive indicator of cardiac damage is troponin I or troponin levels. Even cardiac enzymes like CKMP, creatine kinase, everything will be elevated in this case of myocardial infarction. And the ECG changes are also questioned, that is the ST elevation, T wave inversion, and abnormal Q wave. So, and your lifetime patient has to take dietary modifications and antihypertensives, antiplatelets, usually aspirin and clopidogrel, that is thienopyridines we call, that it will be added to the patient regimen. So these are the few points regarding myocardial infarction, and actually myocardial infarction is a very vast topic. So this is an important point, it's a basic idea regarding myocardial infarction. Okay, and by clicking the below apply button, you can join for the courses what we offer. And thank you.